Hello students. So we are going to start our next chapter, that is the disorders of endocrine system. So there will be series of some different types of disorders. So we will start with first, that is the pituitary gland. So the first disorder is hyperpituitarism. Okay. So the pituitary, it is a pea size gland which is present under the base of your brain. You can see it is in the green color. Okay, and the hyperpituitarism is a condition where the uh, pituitary gland is overproducing the hormones. Okay, so this overproduction of hormones can lead to various conditions, various types of problems related to body's major functions like growth, blood pressure, metabolism, and even sexual functions. So what happens if it becomes overactive? Okay, so if the pituitary gland it's become overactive, it will start to secrete excessive amounts of the hormones. Okay, and this is going to happen when there is any tumor. And keep in mind that tumor will be non-cancerous, that is the benign tumor. Okay, and this overproduction is called hyperpituitarism. Okay, so the various disorders which are related to its overactivity can affect your growth regulation, puberty in the children's, the skin pigmentation, the sexual functions, in lactating mothers, the breast milk production, the thyroid functions, and even the reproduction. So all these functions can get affected if the pituitary glands start to overproduce. Okay, one of these problems comes is acromegaly. Okay, this is happening when the secretion of growth hormone is in excessive amounts. Okay, in acromegaly there will be the growth of hands and feet m- more than the normal. Okay, then there will be changes in the facial structures like the jaws or the brows, they will stick out. Nose, tongue and lips, they will get much bigger than the normal. Okay, skin, it will start to become more thick, more coarse and more oily. Okay, in women's they may feel irregular periods, and in men's they may see erectile dysfunction in their body. Okay, then there may be increased risk for the blood pressure, high blood pressure, diabetes, heart attack, and various other types of cancers. The next condition is gigantism or gigantism. Okay, this occurs in children's when their growth hormone is overproducing. Okay, and they will be growing very rapidly. Okay, and before the ossification, so their limbs, they may be more longer than the others, or their height may be more than the normal person, like 7 feet, 6 7 feet. Okay, whereas the normal body preparations will be same as of a normal individuals. Okay, so the symptoms for the acromegaly and gigantism are their hands and feet, they will be larger than the normal. Okay, their facial features, they will be larger than the other or enlarged. There may be some skin tags. Okay, there may be changes in their body odor. Okay, they may have weakened part also. They may feel headaches. Okay, they may have enlarged tongue than the normal individual. Okay, they may start to feel joint pains before the age. Okay, irregular periods in females and erectile dysfunction in males. Next is hyperprolactinemia. Okay, this is a problem related to the mothers. Okay, and this occurs when a tumor secretes large amounts of prolactin and causing the inappropriate production of milk, that is galactorrhea, or amenorrhea, that is the pain of menstruation. Okay, and it can cause sterility in women and impotence in men. Or in simple word, if we say this condition can cause infertility in both males and females. Symptoms include in women their breasts will become tender. Okay, their breast they start to produce milk, but before even getting pregnant. Okay, reproductive dysfunctions are there. Okay, they may feel irregular menstrual cycles, which leads to infertility or low sex drive, and in males it may shows erectile dysfunction or low energy levels. Now the causes. Okay, if the pituitary gland gets malfunctioned, that is hyperpituitarism, okay, it is going to happen only because of a tumor. Okay, and these tumors they can be non-cancerous, okay, and called as adenomas. Okay, so in this condition, the tumors they will fill the area around with the fluids that will press the pituitary gland, and it will start to produce hormones more than the normal secretions. Okay, so the reason behind this condition is not known, but in some cases it can be due to the genetic features or hereditary. Okay, so for diagnosing the hyperpituitarism, doctors will start to examine a person basis on the conditions seen in his physical examination. So it will include blood test, oral glucose tolerance test, some specialized blood test, along with the MRI or CT scans for the tumor. Okay, and treatment for the hyperpituitarism depends upon the causes seen in the patient. There are only three main treatments: it's surgery, medication, and radiation. Okay, so thank you. This was hyperpituitarism. We will